Well, good morning. My name is Bonnie, and I'm going to be giving you a presentation about oral cancer. We're going to wait a few minutes and make sure that everybody gets in and gets settled and testing their mics. Welcome, Bonnie. I'm going to type over here in my chat to make sure when they're in, they can give me a thumbs up. When their mic is muted, then I need a thumbs up. Okay, so we're going to give me a thumbs up, or I'm going to give myself a thumbs up. So I just want to welcome everybody. You are on question and answer mode. So if you'd like to, you can ask questions. Just raise your hand. They're up in your My Mood. There's a little icon that says raise hand. It's blue, and you have a yes and a no as well. So we're going to get started. Etiology and contributing factors. Oh, excuse me. I'm going to go back and show you my notes real quick. This is our agenda for today. We're going to talk about the causes and the contributing factors of oral cancer. I'm going to show you some images. Some stand out and some are not so, they look more common. We're going to talk about clinical diagnosis, detection, and some helpful links. Okay. This is in place of my whiteboard, since I don't have a whiteboard. And so when you're talking about oral cancer, the two most important risk factors are going to be smoking or smokeless tobacco and alcohol. Usually if you smoke, if you're drinking, you usually smoke. And out here in the Southwest, there's a lot of people who do smokeless tobacco as well. And as a clinician, I've seen 3 to 6 patients that are around the age of 14 that have already started using smokeless tobacco because of their parents. What's happening now is more and more they're finding in the oral pharyngeal cancers, which is in your throat, in the oral cancer, you can get like wart-like lesions. And so these are related specifically to HPV strain 16 and 18 and the herpes virus. And I'm going to talk a little bit about that. I'm going to change my slide. So, oops, I messed up on it's not supposed to be there, so I need to redo that. When you talk about tobacco, it contains a large number of chemical carcinogens, including aromatic hydrocarbons, and these carcinogens have been shown to induce specific genetic changes to certain genes. And the alcohol, they become synergistically, that's the part I missed on this slide, I'm going to have to go back and change it. What synergistic is when it speeds up the effect. And so it produces carcinogenic effects with the tobacco products. And the alcohol is directly acting upon the epithelial cells of the oral mucosa, which increases permeability through its dehydrating effects. That's why, as a clinician, we don't, we don't recommend that you use Listerine, which is an alcohol mouthwash. We do talk about cancer of the lip is due from excessive or heavy exposure of sunlight. And here in New Mexico, we have a lot of people who have a lot of skin cancer and lip cancer. I have seen that. And that is when you're out in the sun, you need sunscreen. And so I'm going to type a message here. What I want you to do in your private chat, I want you to type what factors, what risk factors do you relate to? Do you smoke? Do you drink? Do you smoke and drink? Do you use smokeless tobacco? What I need you to do is tell me as well in your private chat. I need you to tell me, do you see your dentist or your dental professional every 6 months? How often? How often are you seeing your dental professional? That's what I want you to do in your private chat. That's going to only come to me, and nobody else is going to see that. With the viruses, I'm going to go back to this other slide. With the viruses, the herpes virus has been implicated in several cancers in men. They find the herpes simplex proteins in the malignant cells. And also the human papillomavirus, which is, they call it the wart verruca vulgaris, is caused by HPV strain 2 and 4. When you have genital warts, it is caused with HPV 6 and 11. And when you're finding oral cancer in the mouth, which is the squamous cell carcinoma of the tonsils, it is related specifically to 16 and 18. Here's some pictures of some oral cancer on the tongue. I mean, I do oral cancer screenings, sometimes 3. I see 10 patients. I do anywhere from 3 to 10 oral cancer screenings a day. If I know that the patient is a smokeless tobacco user or a smoker, I tend to do that every 6 months. Usually we only do these oral cancer screenings once a year. This is the back of the palate, and as you see, that mirror is way in there. So when you do your home self-exams, you're going to need to make sure you're really looking down in the throat. And this is the tongue. Most cancers are on the tongue, in the throat. Some of the signs and symptoms that you want to look for is like a canker sore that won't go away. At the end of my video, I'm going to share a link with you, and this woman was a young woman, and she didn't smoke and she didn't drink, and there is a wrap session for that. And so if you notice any kind of canker sore in your mouth and it doesn't go away within, about 10 to 14 days, then you need to have it looked at. What we're looking for as professional clinicians, we're looking for any kind of lesions that are white. We call those lesions leukoplakia. Sometimes they're raised, sometimes they're flat, sometimes they can also be red, which we call those erythroplakias, and it can be a patch of tissue in the mouth. I don't know if you've ever seen a canker sore, but it has like a round red ring, and inside it's kind of white. When you do have the red lesions, those red lesions have a higher risk of 3 to 5%. I need to redo my stuff. I'm sorry. Yep, sorry. With detection in the dental office, when you see the professional, you will be getting an intraoral and an extraoral examinations. I know that I palpate behind the ears. We go behind your skull and your hairline. We're palpating your lips, and I palpate the tongue. Those are the things that you will get if you sit in my chair, or should get at any professional's dental hygienist. Radiographs, which are x-rays, they're really important in diagnostic. They tell us a lot. I know a lot of people resist x-rays when they go into the dental office, but it is a good thing to do, and you'll come across that when you're a clinician. Delays, if you're not seeing your dental hygienist or dentist regularly, that can usually fall upon the patient, if they're not going in and being checked. It is also important as a person who wears dentures to be checked, even if you're checking yourself, or go to the dentist once a year and have them check. Here is a link from YouTube. It'll tell you exactly how to do your monthly self-check exam. I have listed here cessation, or to stop using tobacco and alcohol products. There's a stop smoking link. I know that I refer a lot of people to those billboards because they are truly helpful. I had a lady give a testimony about how these people send her little blink, little texts through the day, and they tell her how to combat all of that, all of the cravings, and she had a really good testimony. And so also here is an alcohol withdrawal hotline. And then here is this this link that I'm gonna share with you. I guess I'm not, but here it is. It's a little rap.
My name is Eva Grace. I got a story to tell. I thought it was a canker, so just wouldn't go away. It hurt, and my dentist had nothing to say. I told the oral surgeon was so wrong quick. It even gave me an earache. I was sick of it. I was desperate for answers. I needed a solution, but for 9 months I was living a delusion. You ready for the GX, the diagnosis? Stage 4 oral cancer. Holy Moses! It's a canker, so it doesn't go away. It could be oral cancer, catch it early, don't delay. First voice, like the necklace, system cough. It could be oral cancer, don't shut it off. If a canker sore doesn't go away, it could be oral cancer, catch it early, don't delay. First voice, like the necklace, system cough. It could be oral cancer, don't shut it off. You think this disease is for those who smoke and drink, but look at me, I'm not the type you think would get this disease, but I made it through the roof. I'm lucky this week, I gotta give you all the truth. If a sore doesn't do anything to you,
So I just gave you a little taste of that. I want to wrap this meeting up. I'm going to share with you a poll, and I need you to go ahead and take this poll right here, and I'm going to have you to start voting on this poll. And so we're going to say, yes, this does inspire you to take action in the prevention of oral cancer. So I'm going to submit my vote, but I'm going to let you do your vote. And then we're going to stop, close the poll. And thank you so very much.